Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Rhonda Bryant to the program.
Thank you for having me.
You are the Tobacco Program Coordinator at the Wicomico County Health Department.
Yes.
And you've been on the show before, but
Yes.
now we're going to update the show on a very important issue that's really in the public eye at the moment, and that is about the dangers of vaping.
Yes.
It's become quite the healthcare issue these days.
It has.
So let's first talk about, what is vaping? Tell us a little bit about how it came about and so forth.
Vaping is when someone uses a battery-operated device that is used to inhale nicotine and other harmful toxic chemicals.
Right, and I know they say cigarette smoking, of course, has gotten a bad rap for years now that has, they say, over 7,000 chemicals. So what exactly is in that vaping liquid? Because many people say, well, it's safer than smoking because there's fewer chemicals in it. But it does have some harmful chemicals in it, not to mention nicotine, which is highly addicting, and that's the addictive part of the cigarette as well.
Yes. And some of the other chemicals that are in vape liquid is formaldehyde, and formaldehyde is used to preserve dead things. And another chemical is called diacetyl. And diacetyl can actually cause a person to have a lung condition called popcorn lung.
And what exactly is that? I mean, that's where the lungs become inflamed. We've heard about it on the news.
The lungs become inflamed, and it makes it hard for a person to breathe in and out. It's hard for them to be able to have oxygen in their lungs.
It seems to me, just my recollection of how vaping came about, and of course it doesn't fall under any kind of FDA regulation, unfortunately. For years people were using some standard type devices that you could visibly see.
Yes.
But what's happened of late is, with Joule and some other devices that look like thumb drives,
Yes.
it's much easier to hide it.
Yes.
And this has become a problem, I think, more so with young people.
Yes.
Who are viewing it as a cool thing to do.
Yes.
So what is your thoughts on that and how this has become quite the problem these days?
It's become a problem with mainly the schools, because many of the high school students or even middle school students are vaping or juuling, and the teachers are unaware that they're actually doing it in school. We seem to feel like they've already become addicted to the nicotine that's in the Joule or electronic cigarettes.
Well, we know the nicotine is very addicting, but I guess what also made it trendy is not just the device, but the flavors, correct?
Yes, the flavors have made it more popular because there's over 8,000 different flavors of e-liquid, and one of the favorites to the teenagers is the mango flavor.
The mango, I know, and luckily the Surgeon General, the FDA, have recognized this as a crisis and have put some limits on the flavors.
Yes, they've put a limit on the flavoring. So what they're discussing on doing is just being able to have the menthol and tobacco flavors, which would probably be more geared to adults versus teenagers.
Right, right. And I know one important fact to know is they say that one pod of that nicotine liquid is equal to 20 cigarettes.
Yes, because it has at least 31 milligrams of nicotine in the e-liquid.
Now we're going to get into, of course you already talked about a little bit the dangers of vaping, and one of which is not that this is less important, but they can explode, correct? The actual devices can explode and cause burns. We've heard cases of that.
Yes. In the beginning years, when vape came out, like from 2007 on up to probably 2013, we heard of a lot of cases of explosions where people were either using their vape and they exploded, or sometimes they would have them in their pocket and they could have some type of metal such as change in their pocket, and that could actually cause the explosion as well.
But I know what we want to focus on more is the addiction piece of things and this whole respiratory thing. Like for the past several months, it's been in the news that hundreds of people across the country, and it's mostly young people who are doing a lot of this vaping, are ending up in the hospital on respirators due to this popcorn lung, the lung inflammation. And I think that's what's really brought it in to the public eye as a very dangerous practice.
Yes. We're trying to educate people on the dangers of vaping so we don't see the numbers go up.
And I think you mentioned, we were talking before the show, that there is at least one case locally where someone young has been hospitalized and placed on a ventilator from having this popcorn lung disorder.
So recently, there was a case in Worcester County where a 21-year-old woman who used a vape product was rushed to the hospital with some type of lung issues, and it was found out that she had actually vaped, and she's on a ventilator.
Now, Rhonda, I've seen the acronym EVALI, which stands for e-cigarette and vaping-associated lung injury. And we know we've heard cases of this across the country that has put young people in particular in the hospital. Has the CDC made any headway in figuring out what chemical or what's actually causing these problems with the lung injury and so forth?
Yes, the CDC has found a chemical that is related to the lung conditions. The chemical that has been found is called vitamin E acetate, which is a chemical that is used in THC. With THC is something that actually hardens the vaping liquid and causes these lung injuries.
And we know vitamin E in and of itself is not problematic when it's in food or taken as a vitamin supplement or used in a skin cream. But in this form, the vitamin E acetate, it's problematic when it mixes with the THC.
Yes, because usually vitamin E is something that we can safely use, but once it's mixed with the THC, then it turns into a whole different form.
And of course, when it's inhaled directly into the lungs is where it's really causing some damage.
Yes, it has caused a lot of damage.
So what are the numbers that we know?
The latest numbers are for the actual lung cases has estimated to be at least 2,200 and over 40 deaths.
Well, those numbers are certainly alarming and distressing, but at least it looks like the CDC is getting closer to solving the mystery.
Yes, the CDC continues to work on this issue, and I'm sure there will be more information forthcoming.
Rhonda, we know vaping is not good for anyone, but it seems to be especially problematic in younger people because of the developing brains, and I know you want to talk about that a bit. But before we get to the why, let's talk about the numbers. How prevalent is vaping among our teenagers?
At least 78% of our high school students are vaping, and at least 3.6 million youth have tried vaping at one time or another. And that statistically is 1 in 5 high school students and at least 1 in 20 middle school students.
That's just alarming, isn't it?
Yes, it is.
And I thought we were making such headway on cigarette smoking, and now we have this
Yes.
alternative way to do something harmful, with the nicotine and so forth. And tell us about nicotine specifically. It's highly addictive, we know, and it's problematic for the younger developing brain, correct?
Yes. A student's brain is not fully developed until they're 25 years old, so they don't really understand that with the nicotine addiction, the nicotine addiction is making the teenagers want more and more, because the pleasure principle that we usually get with our brain, especially as being adults, will actually let us know that we need to stop at one point or another. But with teenagers, that's not happening because their brain is not fully developed.
And I guess the one thing is, vaping is a fairly newer phenomenon, so we really don't know about the long-term effects.
We don't.
We know about this mysterious respiratory illness now, but we really don't know about the long-term effects, and it's scary.
Yes, it is.
Okay, Rhonda, before we get into the various devices, I know you want to discuss those in detail, let's just summarize the ill effects of vaping.
Yes. Well, some of the ill effects is the fact that the vape liquid has not only is it flavoring, but it has a lot of sugar in it, and it can affect a teenager's teeth. Other than that, we have the nicotine addiction and the fact that the vape liquid has all those chemicals in it that we really don't know exactly what they are, what it is in the liquid.
And of course, the addiction's the most concerning thing, and we're really going to focus on that. And we also mentioned earlier about the burns, that those pods can be dangerous and have caused burns in some rare cases. All right, and the sugar, I had no idea about that.
Yes, lots of sugar.
And they put dyes in that liquid too?
Yes, dye as well.
They think dyes can affect the lung,
dyes
perhaps?
and the flavoring, yes.
So lots of problems with the actual liquid itself. Okay, so then let's move on to the devices. What are some of the various devices that particularly teens are using to hide this vaping habit in plain sight?
Some of the teens are using, there's different websites where they can purchase vape gear. And some of the vape gear is actually hoodies. And as you know, a lot of teenagers wear hoodies now. With the hoodies, the students can actually hide the vape product in their drawstring on their hoodie. And then there's a little pocket to actually take the drawstring and put the vape product in that little pocket. There's also a book bag that students can probably more than likely vape right in class, and the teacher never knows that's what they're doing, as well as walking down the hallway. They could vape and put it right back in their book bag. There's also an inhaler that we have actually just found out about that students use as a form of vape device. And it's just like, it's a regular inhaler, and that it looks like someone that actually has asthma, they can use it, and it looks like they're actually puffing because they might be having an asthma attack, but it's actually a vape electronic smoking device.
I hadn't heard about that one.
Yes, and that is another new one.
And of course, go ahead.
And then the last one is the iPhone. Many students have iPhones, and the new product that's on the market now is a electronic smoking device that is actually in the form of an iPhone, and it looks just like a regular iPhone.
So it looks like an iPhone.
Yes.
This is not something you get from the iPhone website, but it looks like an iPhone.
Yes, it does.
And I know, we talked about the Joule, that USB device that is the most common thing that has led to this high prevalence. But you wanted to mention something about the actual cartridge itself among teenagers, because it has coloring in it.
Yes.
And also it can look like...
It can also look like a nail polish. Some students that purchase the Joule, when they actually purchase the Joule, it comes with 3 cartridges, and the 3 cartridges actually looks like nail polish. One parent told me she thought that her daughter had nail polish in her book bag, but she found out later that it was actually the cartridge for the Joule, the cartridge liquid for a Joule, which can contain at least 31 milligrams of nicotine.
And with teens just having access to the web and getting all these different devices, it's no wonder the numbers are so high and concerning. So let's now talk about, we know it's dangerous. We also know we don't even know all the ill effects quite yet. It's still fairly early on in its development and so forth. So let's move on to how we can stop this epidemic, or what are some ways in which the health department specifically is looking to help people that have a vaping addiction? Some
of the ways we're trying to help is by educating parents. We suggest if parents want to talk to their child about vaping, if they don't know how to bring up the conversation, they can actually contact us, or they can contact their child's pediatrician. So if they contact us, we actually give them information on the various websites to help teens take care of their nicotine addiction, or educate them on ways to help them quit. Then we also offer 1-800-QUIT-NOW, which is a website specifically is for adults, and it's also for teenagers between the ages of 13 and 17.
Okay.
And then adults 18 and older.
Now you said, I know you wanted to mention that there's a 1-800-QUIT-NOW number that people can call to get over the phone counseling and such, but you have to be older than 17 to
You
use
have to be
that?
older than 13.
13.
13, you can 13 and over.
Okay.
Yes. But usually if a person's 18, they can actually come to our Stop Smoking class.
Okay, there you go.
Yes. So between 13 and 17, they can contact 1-800-QUIT-NOW, and they will do over-the-phone counseling and coaching.
So your smoking cessation classes have expanded into the vaping realm?
Yes. We're still, it's kind of new to us, but we're going to try to do it the same way we do with the actual smoking, because the thing is the nicotine. We're trying the same rules apply. We're
Right.
trying to get people off of nicotine, so we're using the same rules as far as the education, the support, and the stop smoking aids that we actually offer.
I guess the economic issue doesn't help much. People spend a lot of money for packs of cigarettes, and I know the Joule apparatus and the pods,
Yes.
aren't cheap.
No.
But it's mainly once you get addicted to nicotine, the brain just wants more.
Yes.
And I guess, it's tough on young people because they become more easily addicted.
Yes. And that's why we're trying to educate at the Wicomico County Health Department. Majority of the students that get caught in school with some form of vaping device or tobacco product, they are referred to myself at the health department. And when they come to the counseling session, I actually educate the student and the parent, because there's many parents out here that are they don't realize that juuling and vaping is so harmful. So when they come, I educate the student and the parent. And when I educate them, I also assign the students projects. And while doing the projects, they learn a lot about vaping and nicotine addiction and tobacco use.
Well, it sounds like you're doing really good things there at the health department to address this crisis. And I would call it is a crisis, especially
Yes.
when we see teens being hospitalized for lung
Yes.
problems
Yes.
that shouldn't be happening. And I guess the best advice is, if you don't vape, don't start.
Yes, if you don't vape, don't start.
But once you start, it's pretty tough to quit. But it sounds like you have some great strategies in place.
Yes.
It reminds me of years ago with the whole smoking cigarette thing.
Yes,
And
yeah, it's pretty much almost the same, but it's just the age groups.
Well, it always was a thing about smoking that it was, cool to smoke.
Yes,
So I
and now
guess the other thing we have to do is just educate that it's just not smart to vape,
Yes.
and the coolness thing has to be addressed too, because that's so important to in the teenage years.
It is. One other thing that I actually do with the students when they come, I try to get them to think. We want you to be leaders, not followers, because a lot of the students that vape are actually vaping because their friends vape and their friends actually have them try it. And once they try it, they more than likely become addicted, so they continue trying it.
So Rhonda, I guess summarize for us too, what are some of the strategies the government is putting into place now that we have this crisis?
One of the things that the government has done, they have raised the legal age to purchase tobacco products to 21. Originally it was 18, but now the person has to be 21. So people that were 18 that was purchasing, they're no longer able to purchase them, whether it's online or in the stores.
So that includes cigarettes and vaping products?
Yes.
Okay, well, this is a tremendously important issue and a huge topic to cover, and I thank you so much for coming in to talk about this, because it's so important, especially since our young people are so impacted by this. And I just happened to look, the Surgeon General has put out a statement about it, and it's mentioned 600% surge in sales. So something has to be done to stop it. And luckily we have lots of different organizations of government, and of course the Wicomico County Health Department doing its part in addressing this. So I know you also want to share several websites that we'll post at the end of the program. Some are the basic ones, the CDC, the American Lung Association, and of course the Wicomico Health Department itself.
Yes.
Will put down contact information.
Yes.
And also what I think is very very good is you brought some websites that are specifically addressing the teenager issue,
Yeah.
that teens can check out these websites. So we'll put those all at the end of the program.
Okay.
It's so important, and thank you again for coming in.
You're welcome.
And thank you for joining us for this edition of Focus on Health here on PAC 14.